Now, a cordless technique, we don't always have to do that. For example, there's equigingival crown margins, there's supragingival crown margins, and barely subgingival ones. And we can be a little more gentle and use something here, a cordless retraction system. This is Traxodent. It's 15% aluminum chloride, gentle pressure for lateral displacement of the sulcular tissue. Remember, in the two-cord technique, test question that I like, the bottom cord provides vertical retraction of the tissue. That top number 2 cord provides the lateral retraction of the tissue for the impression material. But it's not gentle pressure. That number 2 cord, first of all, it doesn't fit everywhere, but second of all, it puts a lot of pressure. This is much more gentle. It absorbs excess sulcular fluids, which is nice, and then those cotton caps will guide it into the sulcus and help hold it in place and keep the patient's tongue away from it. So if I don't have room for a top cord, the sulcus is too shallow, and I'll show you that on a patient that I treated a few weeks ago where we happened to be filming. The double zero cord goes right in, barely on the facial, because it's an upper bicuspid, not a lot of attached gingiva. There's no way I was getting another cord in, let alone a number 2 cord. I wasn't getting a number 1 or a 0 or a double zero, so I used Traxodent on top of it. Placing a top cord could have possibly damaged the attachment. It would have certainly damaged the attachment in her case. I could have billed probably for a gingivectomy. When margins are equigingival, as seen most typically on veneers and no prep veneers, even though we don't have any margins on those, I use Traxodent to give myself some gentle vertical retraction. I don't want to put no prep veneer margins subgingival because I want the patient to be able to brush them and keep them clean, but I want a little bit of retraction so we can just sneak them ever so much under the gingiva, especially if we're doing a shade change with these veneers. We don't want to see where the tooth color and the veneer color come together. And another great time, if I'm using a diode laser in the posterior because the patient's been packing food in between 2 teeth and I probably shouldn't be taking an impression that day, if that's happening, I am going to go ahead after the diode laser and put the Traxodent and the compression cap on top of it, because that will in fact stop any bleeding that's continuing after that.